the help of that PowerPoint only.
Yes, ma'am, definitely. So I'll be just starting with an introduction so that we are not, behind the time. So I'll just share the introductory part and then you can, and then I'll hand over to you. So I'll just start. Good afternoon, everyone. So we are here within another session today for all psoriasis patients and caregivers, also for various doctors and healthcare professionals. Our topic for today is psoriasis and COVID-19. So today our expert for the session is Dr. Vibhu Mendiratta, who is the Director Professor at the Department of Dermatology at Lady Hardinge Medical College. And she's an associate at Susteta Krilpani and Kalavati Saran Children Hospital in New Delhi, India. Welcome, Dr. Vibhu. It has been like a great interaction with you, and you have been so kind enough for, helping out to all our patients and caregivers to deliver the session on psoriasis and COVID-19 today. And also today marks the month for the Psoriasis Awareness Month. And on 1st October, we are holding such a great informative session with a great expert today. So talking about her qualifications, she's an MBBS MD Dermatology from Maulana Azad Medical College. She has been achieved several achievements, like she have been awarded with several awards like Sardari Lal Memorial Award, and she is the president of IDVL Delhi State Branch, and she has various research interest in psoriasis, geriatric dermatology, infections, acne, hair loss, and disorders of pigmentations. So here is, so I'll just go faster so that we are not, delaying the session. So today the flow of the session would be, she'll talk about psoriasis and COVID-19, the myths and facts. Usually the psoriasis survivors are confused about, and the challenges during managing psoriasis during COVID-19. If you catch COVID-19, how you should manage your psoriasis. So because it's a dual kind of management when you have to do, and various myths and facts about COVID-19 vaccine and psoriasis as well. So after that there'll be Q&A session, and then we'll be concluding and thanking you all. So here is instructions for the participants. So they will be muted and their video will be disabled. If you have any question, they can just put it in the chat section, and then we'll have the expert session where we will have a Q&A session, and any questions that will be answered by Dr. Vibhu. Thank you so much. And just to brief about the upcoming events, we are organizing a World Psoriasis Day on 27th of October at 4 p.m. where you can share your story, you can share your journey with us, you can share what struggles and what challenges you have faced during your journey. And we invite all psoriasis patients and caregivers. Also, I would request to all healthcare professionals who have joined us today to disseminate amongst your patients so that they can share their story for the cause of change during the awareness month, and we can make noise about how this this topic is important, and this has to be put it at the policy table because it's lacking there, and we have to put our patient's voice at the policy table so that we are heard, our challenges are heard, and we are towards the change, towards a positive change around the policy. If you want to share your story, you can just contact on this number, or you can just share your names on this email ID that is displayed. I will also put it in the chat section. Thank you so much. Now I will hand over to Dr. Vibhu for her session. Thank you so much.
Yeah, thank you. Thank you, Tamanna. And I think it's a great initiative. I'm just trying to share my screen with you. Is it visible?
Yeah, ma'am.
Hello, Tamanna,
yeah,
am I audible?
Yes, ma'am. You are audible very well. It's just started.
Hello.
Yeah, Dr. Vibhu.
Okay.
Yeah.
All right. So so first of all, a very good afternoon to everyone. We are logging in on Saturday afternoon. Saturday is a very precious day, I think, for everyone, because I think the mood is different, anything other than work. But today, the topic before us, or I should say, the challenge before us is really very great, and that is from the point of view of a dermatologist, practicing dermatologist, who encounters patients of psoriasis almost daily. Some are in good shape with a localized disease, and some have a very terrible disease. And we are also I'm going to discuss actually the relationship of these two challenges, which are COVID-19 and psoriasis. So COVID-19, as we all know, has complicated matters for chronic diseases. And amongst the chronic diseases, psoriasis is one disease which tops the list of all the dermatological diseases, as it's a lifelong disease and it has got no cure. We can only manage the disease, we can only prevent the complications, but the disease does not have any cure. So what does it look like? We all know that it's a disease which has got a genetic predisposition. It is multifactorial in nature. So patients will have some family, background wherein we would be able to find that there is a history of the disease in the family members. Or at the same time, it also gets aggravated by exposure to certain drugs, certain infections. And today we are talking about COVID-19, which is a viral infection. All of us know that even for the benefit of the patients who have logged in today. So COVID-19 is nothing but a viral infection. And psoriasis is a disease which can be aggravated, precipitated, or be flared by sore throats, which can be bacterial sore throats, or they could be viral URIs. So COVID-19, we know that it presents with sore throat, which is one of the most common symptoms. And it is, speculated that infection with COVID-19 can give rise to a flare-up in the disease. And how it looks like, it may present with new lesions appearing. There can be new patches of psoriasis appearing. There can be sudden redness all over the body, which is a very serious and a severe condition. So that is one impact that I'm going to talk about. And second thing is how to manage. So are there, drugs? Because for these psoriatic patients, we use many immunosuppressive drugs. And if we are suppressing the immune mechanisms of the body, so what does our immunity do? Our immunity helps us fight the invasion by the bacteria and the viruses. So if for psoriasis, if we are using some immunosuppressive drug, it will knock out the immunity of that person. And that person might become more susceptible for acquiring COVID-19 infection. So we are going to see whether it actually affects or not. So this is only to tell you or emphasize that it is not only adults which can, have psoriasis. All age groups, including children and even babies, infants, can have severe psoriasis. So it runs through the entire age spectrum. Now, also another point for my patient's benefit is that we should not see psoriasis as a cutaneous disease, only skin confined disease. This disease has got its impact on many organ systems of the body. So we have patients of psoriasis who are more prone for developing heart disease. They run a risk of having complications which impact their heart. They can also have a high risk of diabetes and atherosclerosis. There can be obesity, and all these things, along with their skin condition, can drive them to depression and stress. So this is the impact of the disease. Now, when we come to the treatment, then the treatment has to be addressed in COVID times, self-management. That is the first and foremost thing. And in the self-management, because so now the scenario when we talk about COVID-19, it is much better because the prevalence of the disease is much less. The number of cases, new cases, has gone down. So the patients, they are able to come for their treatment to the hospital very easily. But earlier on, when there was this pandemic going on with lots of deaths and lots of mortality and morbidity due to COVID-19, so in those times, our emphasis was on teledermatological consultations, and these patients, were free to contact the doctors, my team, and the other physicians through the link which was given to them. So self-management is number one, and they have to observe certain do's and don'ts. Otherwise, when we talk about the treatment, it can be a medical treatment, and there can be, generally topical creams and ointments are given to these patients for application. Then, in case the disease is more severe, we are making use of systemic therapies, and we are also using, trying to give them a support system in case they have any problem, any challenge, any psychosocial, psychological support is required. It is extended to them as far as possible. So what were the concerns regarding psoriatic patients during pandemic? Now, first one was, what could be the impact of SARS COVID infection on psoriasis, and does psoriasis influence the risk to evolve towards serious COVID infection, because the disease can predispose to a serious infection. So these were the basically thoughts in the mind. Now, why do we say that COVID can have crucial impact on psoriasis? Is because we know that it is chronic disease, and any infection can aggravate the disease. Number two, psoriasis has many metabolic abnormalities, and diabetes, kidney disease, etc. They also make the patient susceptible for a severe COVID-19 infection. Then thirdly, severe psoriatics are given immunosuppressive agents. So these immunosuppressives can cause evolution of a severe COVID infection. And vaccination, because the vaccination for COVID has also been reported to cause flare-ups and new onset COVID. Gutted psoriasis is one type of psoriasis where, it has been seen that after the patient received COVID-19 vaccine, and this flare-up took place. So in short, it is basically COVID-19 can worsen psoriasis, and how to cope up with psoriasis during COVID-19. So now for the patients, we would tell them that they should continue taking all medications, whatever they were taking previously. So they have to stay in touch with the doctor. So it is through phone or through telemedicine. They have to keep their skin moisturized. That is very important, because dry skin can cause itching and can cause traumatization of the skin and psoriasis flare. They should look after their diet, have enough rest, take all precautions of mask, hand hygiene, and topical treatment they should continue with, even if they have COVID. They should wash hands, but they should not use sanitizers, because hand sanitizers can cause cracks in the skin that predisposes them to infections. So they have to observe these measures. Now, what are the general guidelines for managing psoriasis during the COVID-19 pandemic? That those patients of psoriasis who have associated diseases like diabetes, they should be more concerned. Those who have some underlying renal disease, or who are obese, who have some heart disease, they should be very particular, and they should stay in touch with their doctor. And as I said, that now there are no restrictions on the use of any kind of oral medication in psoriatics in COVID, along with COVID-19. Okay. So they can continue to use their biological agents also and their oral medication also. Only thing is that high dose corticosteroids are to be avoided, and if at all steroids are to be used, they are to be used in the lowest possible dose. So now what are the problems which are faced by the caregivers, like the doctors? The problems that we face at our end in treating psoriasis is that most of the times during the COVID-19 pandemic, we went virtual. Kind of, we were having virtual clinics. We could not see the patients physically, and we could only talk to them and assess their disease through the computer or whatever device. So that was kind of a suboptimal care. So it was a big challenge to modify the treatment of a patient who's just talking to us on phone, and we are not really able to assess the patient's entire skin and the lab reports also. So that was the biggest challenge. Second thing was that in the ward, we were just patients who were having severe disease also and who required more indoor care. Those patients also were, being discharged very fast from the wards, because for the risk of acquiring in hospital acquired infection. So they were being discharged very fast. We had limited admissions in the ward. So there was a restriction on the admissions also in our dermatology ward. There was restriction on the relatives also. We did not want that our wards or the hospital area should become crowded, because that would lead to spread of COVID infection. So this was basically a challenge for the patients also, because once somebody is, admitted, one would want that some support, moral support, emotional support, logistic support is extended to the patient by the relative. So since the relatives were kind of, discouraged from coming and visiting, that was a challenge. My team, the entire staff had, really, it was a huge struggle for us to get the medicines, because the medicines were not available. Then there was increased workload because they had to do duties for the COVID wards also. So it was like a tussle between many things. So that was our point of view. And then I would just touch upon the exacerbation of psoriasis following COVID-19 vaccination. So it is a reality that some vaccines can cause new onset psoriasis and psoriasis flares also. And importantly, among these are the Moderna and the RNA vaccines. Thankfully, the vaccines, the Covaxin is not an mRNA vaccine. So still there are some reports which have reported new onset psoriasis. So it is a reality, and the interval between the appearance of the new psoriasis can vary from 1 to 2 days to as long as up to 3 months. Also, the patients can report to have psoriasis, but by and large, fortunately, the vaccine-induced psoriasis has been reported to be a very milder kind of a variant, which goes it improves on its own, and it lasts for few days to few weeks. So cases have been reported, and adverse events have been reported. Now, various mechanisms, again, I will not go into the details, because it is at the level of the immune cells which are activated when vaccine is given. So that leads to this inflammation. Nevertheless, we must understand this fact that psoriatic patients who do not have any other contraindication for vaccination, they must go ahead and get themselves vaccinated. That is very, very important. and they should not simply avoid taking vaccine just because they have psoriasis. So now the CDC says that CDC does not include people with psoriasis in high risk groups for infection or complication. So people with psoriasis who are taking immunosuppressive therapies, they should continue to take their drugs like methotrexate, cyclosporin, they should continue to take, and they should get vaccinated as early as possible. Now, this is a drug which we use for treating psoriasis. Interestingly, some data has come which says that cyclosporin can block the replication of SARS-CoV virus. So this drug can be useful. It is very early to say. Even the international bodies like CDC also still maintains that there is not very good quality evidence in terms of clear cut saying that we should continue the drugs or not. But so far they have maintained that these drugs should be continued, and some drugs like cyclosporin can reduce the proliferation of this COVID-19 virus. Now, some studies have shown that patients who were using biologicals and who were using these oral drugs, they remained in remission in COVID, along with COVID-19 when they had this COVID infection, and they were also simultaneously using either biological or any other oral drug. They remained in remission. Their psoriasis did not flare up. And so it was a beneficial effect of these drugs like biologicals and the other oral drugs. So they should continue. They should not discontinue the therapy. And so this is again to suggest the same thing, that although there are few reports, but it is not discontinued. The therapy is not discontinued, and rather it was seen that patients of psoriasis who also had COVID-19 and they were hospitalized and they were taking biologicals, there was no mortality among them. So the course of COVID-19 was not very serious in them. Rather, the factors which were responsible for a serious outcome in these patients was diabetes. Uncontrolled diabetes was rather one factor which caused a poor outcome in these patients rather than their biological drug that they were taking. So methotrexate is a very cheap drug, and we use it as as a first line drug for patients of moderate to severe psoriasis who do not respond well to just local therapy. Now, this drug also has been found to be useful in the management of psoriasis and can be used even during the COVID-19 times. And the safest would be acitretin, which is a vitamin A derivative, synthetic vitamin A derivative. It is a non-immunosuppressive agent, and it has been concluded to be safe during the pandemic. Similarly, we have another agent which is not an immunosuppressive agent, and it may be a safe alternative. So only I just want to emphasize that we have choices. We have choices other than immunosuppressive agents, other than steroids, which can be used for the treatment of these moderate to severe psoriatic patients in order to improve their disease. And now biological agents also, they also have been, there is data which is emerging that biologicals can be helpful in psoriatic patients and can minimize their risks of being admitted to the ICU if they have. So it rather is beneficial during psoriasis. So psoriasis cannot be cured, but we must manage the psoriasis to minimize physical and psychological harm, because many a times these patients, they also have underlying depression, they have anxiety, they are not able to perform their daily duties, responsibilities, effectively, because they tend to have suicidal tendencies. So it requires a multi-speciality approach. Psoriasis treatment requires a multi-speciality approach. We must identify that what are the other coexisting morbidities in these patients, what are the other diseases that these patients are coping up with. We must identify them, treat them, and lifestyle modification in psoriatics is very important. They should have a good diet which should be rich in polyunsaturated fatty acids. It should not have the other, high fat content and high carb content should be avoided. Active lifestyle, they should quit smoking, they should quit alcohol, and they should be outdoor in the sun and some physical activity. So all these things, along with remaining in touch with their support groups and with their physician from time to time, can really help solve this challenge for them. Thank you. I'm done.
Thank you so much, Dr. Vibhu, for giving us such an insightful information, because you have highlighted some of the things that usually psoriasis patients don't know, like using of sanitizers and everything. So that is the very, very important thing that you have highlighted, and some of the drugs that we do have the alternatives to treat that, and how that psoriasis is linked with COVID-19, because many of them were having questions of having that myth, we'll not take the vaccination because it might be life threatening, or what because there are no alternatives. So it's very important that you are in touch with your dermatologist, your specialist, so that in continuation, so that that doctor can actually keep a track on how your body is responding to that COVID-19 vaccination. So we do have like some of few of the questions from our group, like is it that like you have totally explained the process, so you said that you need to eat something that healthy and everything. So can you please help us with some of the things that you should mainly avoid during these times when you take vaccination, like in eating or something like that, or what rich food they can eat so that they are able to manage their
See,
part.
diet has a role in almost every chronic autoimmune disease, including psoriasis. So, like as I said, that psoriasis is just not skin deep. It has an impact. It is associated with obesity also and metabolic syndrome. So, in order to keep our metabolism healthy, first of all, the healthy diet would mean that there should be good protein in it, and there should be less of unsaturated fatty acids. Psoriatics can include more of omega-3 fatty acids because they are anti-inflammatory, and they will also keep the psoriatic inflammation under check. They have to keep themselves hydrated, and at the same time, they should avoid alcohol. That is very important. And smoking. They should always quit smoking, and any substance abuse, if they are addicted to any drugs, they should stop using those. Also, another important precaution is that many drugs like hydroxychloroquine. Now, we know that hydroxychloroquine was used as a preventive medication for COVID-19. But hydroxychloroquine is contraindicated in psoriasis because it can precipitate psoriasis. So I would tell my patients that they should not be using any drug unchecked on their own. There should not be any self-medication. And in case they are using any medication, be it allopathic drug or a homeopathic drug, they should get it verified by their treating doctor, because many medications used for hypertension, used for, like I told you about hydroxychloroquine, and certain agents, beta blockers, they can give rise to psoriasis. They can aggravate. So that caution they need to exercise.
Yes, ma'am, that's very right that you what talked about how the diet is important in each and every aspect that you said, and it's important to get in touch with the.
Another thing is that vitamin D is very important for them.
Hmm.
So most of us in India are deficient in vitamin D, and vitamin D prevents the auto inflammation. So psoriasis is just the body's own immune response against body's skin cells. The skin cells, they start proliferating, dividing very fast. So vitamin D does wonderfully well in controlling, checking this rapid turnover of the cells.
Hmm.
So all those patients, they must take good, dietary vitamin D, or at least be in the sun, have milk. Milk is a good source of vitamin D, egg, poultry, dairy, and those of them who are non-vegetarians, they can have fish, which is a good source of vitamin D. So that is very important, and it can be therapeutic also.
Oh, that's really great, ma'am, that you highlighted that what can be taken and what cannot. So, like my next question from various psoriasis patients were that during the vaccine, when they take a booster dose, they have, struggled from that myth that, they should not go. So, like, what are your key points on that? Like, vaccination is equally important.
Vaccination is important because, as I told you, that we are still not very confident about the mechanisms of SARS-CoV virus. We are still not very absolutely 100% sure about the way this virus will behave in any individual, especially the one who is unvaccinated. And since psoriatic patients, they have some compromised function, you know, most of them will have some lipid abnormality, they will have some underlying, raised blood sugar, they may have obesity also, and even their liver function and kidney functions also, we in comparison to a normal person, will be little suboptimal. So it is mandatory that these patients should not miss their booster doses, because they will be requiring many drugs, as I talked about, that these drugs will be suppressing their immunity, making them further susceptible, prone,
Hmm.
they'll become more prone to develop infections. So they should not miss their scheduled booster dosage, and they should go and get it. In fact, we also tell them in India, we do not give prophylactic vaccines against influenza virus, but in the West, it is mandatory that these patients of psoriasis, they
Okay.
are given influenza vaccine also after every 2 years, in order to check the disease also, and also to before starting
Hmm.
the therapy in these patients. So they should not delay.
That's really something very new that I have heard. Like in every 2 years, there is a vaccine because I have seen many of the psoriasis patients. They usually, lost that connect with the specialist when they're not facing any flare-ups, or they think that yeah, everything is going
Yes.
well, and they are on that medicine that you have that already they have been prescribed before. If they get the flare-ups, they take that medicine again and again, and they make it worse,
Yes.
that condition get worse. Like you actually highlighted in your presentation, it's very important that dosage of the drugs during the psoriasis, during the psoriasis, and when you get COVID-19 has to be managed. So that's something that I think patients would have learned today, because this was very new to me. The information that you give us today was very rich, and very new, because I was also not aware about that. Being a normal like we what we do in when we get COVID-19 is that we usually take the medicines on our own, saying that yeah, we will get fine, but they do not see the part that the person is already living with that condition, and that's also needs to be in align with what you are taking. So that's very important to get in touch with your specialist at that time. And also what how would you doctor explain that counseling, you said that counseling needs to be there, so what are your key points on how this counseling can actually be given, and as a part of a patient organization, what patient organization can contribute in terms of counseling to psoriasis patient, that why vaccination is important, you shouldn't back it, that will not take any dosage or booster dose, and how a dermatologist, healthcare professionals can come out and say and counsel that patient.
See, counseling has a great impact on the mind because simply in the clinics, what is done is that we just prescribe a couple of medications for them, hand over the prescription to them, and just tell them how it is to be taken. That's about it all. So the background information of the disease is very important, mainly for the person, for the patient, because unless the patient knows about the disease course, the disease morbidities, complications, what can happen, and so the various do's and don'ts, the patient's responsibilities, so that part has to be explained to the patient. And that also depends, like most of the times in government hospitals, the patients are from lower social strata. They are not really very well educated, so they will not be self educating themselves. So that is what is important here to understand, that for those who are educated, they are able to add more information to their knowledge on their own by reading about the disease. And these patients who come to us in the government hospitals, they need to be told about their lifestyle modifications, about how important it is to adhere to the treatment, to be compliant with the treatment, to be compliant with the advice, the general advice given to the patient also is very important. So the doctor plays a very important role. But sadly, what happens is that doctor cannot be present all the time. So there has to be provision for a counselor. What the government or what the policy makers can do is that for the chronic diseases like this, there should be provision for a counselor who can be there and who can clarify all these doubts of the patients. So now comes the question of vaccination. Now, vaccination, again, the treating physician can emphasize upon taking the vaccine, and what is the plus point, what is the advantage of getting vaccinated. So that can be told to them. Also, at the same time, certain patient support groups. Now, the patient support groups, what will they do? They will be citing their own example, and the patient will be more convinced to talk to the other patients of psoriasis who have taken the vaccine and nothing has happened. So that will, endorse the medical advice, because if it comes from their own uh, group. So that is what.
That's great, ma'am, because it's very important as a community that patients should actually come out and speak about their experiences. Because if as a I have seen, if as a healthcare professional or as a normal community or as a caregiver, as a normal person, I cannot just speak to the patient saying that okay, you take the vaccination, it's very good for, but as an experience, if a patient comes out and speaks, that yes, it has been my experience and I have been, treated very well, and I was properly counseled and was in touch with my dermatologist regarding when I took vaccination and everything. So I think that today concluding that it's very important that you take the vaccination, and when you take the vaccination, it's very important to get in touch with your dermatologist. You should report a single flare up as well, so that it can be managed at that point of time through your dermatologist. Because patients have been, seeing that, okay, I have taken that booster dose and now flare ups are there and I can take the normal medicines that have already been prescribed, and they take again and again, and that gets worse, and they blames the vaccination, that, oh, that vaccination have, worsened my condition. So like there are pros and cons of everything. So you have actually explained how we need to balance each of them. We need to have that balance of, how you take that vaccination and how there has to be an alignment management with the dermatologist. So it was very well explained, Dr. Vibhu, and thank you so much for, spending time today and giving your such an insightful and valuable information to all the psoriasis patients and caregivers who have joined us today, and taking out your
Thank you.
time from Saturday. And I know that everyone on Saturday, the participants who have joined us have also, get their queries, who were actually curious about that, what should be done and how can be done. So that also questions must have been answered through this session. And thank you so much, Dr. Vibhu. If
Thank
anything
you.
will be there, we will definitely reach out to you with more such sessions, so that we are connected with each other, and
Yeah.
more and more noise of, why psoriasis is actually important at the policy table. We can throw out that voice through the community with your support. So your blessings and your support are much needed throughout this journey of the initiative, and you supported us through your kindness and through your, all wholeheartedly. So thank you so much,
Thank
Dr.
you. Thank you. Thank you, Tamanna. Thank you
Thank you
so
so much,
much. Thank
Dr.
you. Thank you.
To all the participants to whom I have said that I will share the link for the World Psoriasis Day, so that everyone can, have a so that they can join us on the World Psoriasis Day. So I'm just sharing the link and the email ID in the chat section, so that you can share your story with us. Also, I would request all the healthcare professionals as well to please disseminate amongst your, patients. So I have just put it, the email ID and the contact number in the chat section. Also, I'll be just posting out the registration link in the chat section, so that anyone who is interested for to join the psoriasis event, they can join, because your voice as a caregiver is very, and patience is very, very important during the World Psoriasis Month. And I hope that everyone will, contribute towards this cause that we as a community of psoriasis supporters are doing. Because without your support, we won't be able to, get onto that goal of making that noise at the policy table, that why psoriasis has to be, I put it at the policy table. So I have also shared the link in the chat section of the registration link. Everyone can come out and register for the World Psoriasis Day. And if you have any questions, you can also email us to the email ID that I have shared in the chat section, and to the phone number. And you can share your journey. Please come out and share your journey. Your journey will be, would be very, very valuable for the people who are in the community, psoriasis community, as a part of an awareness, also as a part of your motivation and journey. So thank you so much. I'll end today's session.